Hello everyone, my name is Christina Putanaite and I'm a student at Eastern Kentucky's University School of Nursing. Thank you for joining me for this presentation titled Addressing Insomnia in Older Adults Through CBT-I in Primary Care. The meaning would be it's a cognitive behavioral therapy for insomnia. In the next few minutes, I'll walk you through the significance of insomnia in older adults and my selected evidence-based intervention CBT-I and how this can be effectively implemented by nurses in the primary care settings to improve sleep, reduce medication reliance, and enhance quality of life. So a little bit about background and significance. Insomnia affects nearly 50% of adults aged 65 and older. It's not just a sleep issue, it's associated with increased risk of falls, depression, cognitive decline, and poor overall quality of life. Unfortunately, insomnia in this population is often managed with sedative hypnotic medications, which can lead to side effects like confusion, dizziness, and dependency. Clinical guidelines now recommend cognitive behavioral therapy for insomnia as a first line treatment. However, it remains underused, especially in the primary care. That gap in care presents an opportunity. Nurse led CBT-I offers a safe, sustainable, and evidence based approach tailored to older adults and is well suited for delivery in primary care clinics. So, theoretical framework, I chose Newman system model. So this project is grounded in Betty's Newman system model, which sees patient as a system interacting with internal and external stressors. Insomnia is a multidimensional stressor affecting mind and body. CBT-I supports system stability by helping patients adapt to stress through behavioral change, cognitive restructuring, and healthy routines. It addresses interpersonal stress like anxiety or thoughts, interpersonal stress like caregiver strain, and extra personal stresses such as environmental noise or routine disruption. This holistic model supports the CBT-I structure and aligns with its focus on the patient-centered wellness and resilience. So, proposed interventions and evidence summary. The proposed intervention is a 6-week nurse-led CBT-I program tailored for older adults in primary care. Let me share the 3 key pieces of supporting evidence. The first one I chose is the Irvin in 2014 that conducted an RCT comparing CBT-I to Tai Chi. Results show that CBT-I significantly improved sleep quality and reduced inflammatory risk, highlighting its physiological benefits beyond sleep. Second one is the Crowther and all in 2023 who reviewed how CBT-I can be adapted across contents, including older adults with comorbidities, confirming its versatility and safety. And the third one is Bachette et al. In 2023, who emphasized the vital role of primary care and community nurses in managing sleep health and endorsed CBT-I as a valuable and nurse-led intervention. These studies collectively support CBT-I as effective, adaptable, and implementable by nurses. So, implementation plan. Here's how the intervention would work. Week 1, I will identify adults age 65 and plus using the Insomnia Severity Index, ISI. Enroll eligible patients, obtain consent, and collect baseline ICI scores. Weeks 2 to 7, deliver 1 CBT-I session per week. Each session would include sleep restrictions, stimulus control, cognitive restructuring, relaxation training, and sleep hygiene techniques. Patients complete sleep diaries to track progress, and week 8 would be post-intervention evaluation using ICI and satisfaction survey. Month 3, 1 booster session with final reassessment. Sessions can be delivered in person or via telehealth, depending on the patient's preference and access. Outcome measures. Outcomes will be tracked using both objective and patient-reported data. ICI score reduction by more or equal 7 points, which indicates clinically significant improvement, decreased use of sedative hypnotic medications, improved sleep onset, latency, and duration, measured via sleep diaries. Enhanced daytime functioning and satisfaction, got through patient surveys. These outcomes are meaningful not just for sleep, but also for preventing falls, improving mood, and enhancing cognition in aging populations. Timeline overview. The entire project spans roughly 3 months. Week 1 would be in screen and enroll patients. Week 2 through 7, deliver 6 CBT-I sessions. Week 8, conduct post-intervention evaluations. Month 3 would be deliver a follow-up booster session and complete outcome assessments. Regular team meetings during the project allow for feedback, adjustment, and interprofessional collaboration. Dissemination strategy. Dissemination is the key to bridging research and real-world practice. To promote wider use of CBT-I in primary care, I plan to present findings at nursing and primary care conferences, share educational materials with clinics, propose in-service trainings for nursing staff, submit an abstract for publication in journals like the Journal of Gerontological Nursing. And these strategies empower nurses to lead change and implement CBT-I beyond this project, ultimately improving outcomes at scale. And conclusion. In summary, insomnia in older adults is common and highly treatable without relying on medication. CBT-I is evidence-based, well-supported by theory, and highly suitable for nurse-led delivery in primary care. With structured implementation and strong outcomes, this project aims to improve sleep health, quality of life, and safety for older adults. Thank you so much for your attention. I would be happy to answer any questions or discuss further in your comments.